Hi, everybody. This is Congressman Mike Levin. I want to thank you for joining us for another virtual town hall meeting on the coronavirus, which we are doing every Wednesday at mikelevin.house.gov and on our Twitter and on our Facebook feeds as well. And we decided to be best if we did these from our homes, so hopefully the video and audio quality are quite good. I'm honored to once again be joined by a local expert, Dr. Carl Steinberg from Scripps Health. Dr. Steinberg has been a skilled nursing facility and hospice medical director in North County for over 25 years. He got his bachelor's degree from Harvard, and he went to the Ohio State University College of Medicine, and then he completed his family medicine residency at UC San Diego. He's a leader in multiple organizations, including the board of directors of the San Diego County Medical Society, the Coalition for Compassionate Care of California, and the California Association of Long-Term Care Medicine. And he has an active nursing home and hospice practice, including making home visits. And I also found out from Dr. Steinberg that, like me, his parents, his father is of Jewish background and his mother is of Mexican-American background. So that's definitely an interesting coincidence. Dr. Steinberg, thank you so much for joining us today.
Pleasure to be here. Thanks for having me.
So over the next hour or 90 minutes or so, we're going to share the latest public health and safety information, as well as let you know about the latest actions we're taking in Congress. And we're going to take your questions along the way. In order to ask questions, we'd encourage you to comment in the live stream itself, or you can email us. And the email address is mlevin.press@mail.house.gov. That email again, mlevin.press, P-R-E-S-S, @mail.house.gov. We'll try to get through as many of the questions as we can, and if we don't get through them this week, we'll do our best to try to get through them in future town halls. As I've said before, a lot of this information is very scary, and obviously the most important thing we can do right now is to follow the guidelines, federal, state, county, and city guidelines, and Dr. Steinberg will be speaking more about those guidelines. But I wanted to share the most updated numbers, and they really are tragic. In the United States, we now have 210,646 cases of COVID-19 confirmed, with 4,702 deaths. In California, 9,551 cases, 206 deaths. In San Diego County, 849 cases and 15 deaths, and in Orange County, 606 cases and 10 deaths. And folks, there's so much more than just statistics. These are family members and loved ones, fathers and mothers and sisters and brothers, each with a story. And it's such an incredible, unspeakable tragedy as we see the numbers continue to grow. We're facing two simultaneous crises in our country. One is the obvious public health crisis. The other is an economic crisis. And in my opinion, the best way that we deal with the economic crisis is to tackle the public health crisis head on. And that's why it's so critically important that we flatten the curve and follow those guidelines. Last Thursday night and into Friday morning, I flew to Washington, D.C. to pass our third bill on this coronavirus relief effort, the CARES Act. And I thought I would just very briefly take you through a history. It was February 25th, not that long ago, at the end of February, that the Trump administration came to the Congress and requested $2.5 billion as the whole of the federal response to COVID-19. $1.25 of that was new money. $1.25 was to be moved from other sources. And we knew even then that that wasn't nearly enough, so we upped that to $8.3 billion, and we passed that in a bipartisan fashion. And that was supposed to go to specifically the development of the vaccine and to a variety of state and local health agencies. As soon as we passed that supplemental appropriation, we knew that wasn't going to be enough. So we went back and developed another bipartisan package, the Family's First bill. It's a $104 billion package designed primarily at things like paid sick leave and emergency leave. We passed that overwhelmingly, and then we knew very shortly thereafter that wouldn't be enough. And so we worked on a third bill, and it's called the CARES Act. You've probably heard a lot about it. It's not perfect by any stretch of the imagination, but what it is designed to do is to focus on those two interrelated crises, the public health crisis and the economic crisis. With regard to the public health crisis, we're talking about $100 billion for hospitals, $150 billion for states and localities, for the obviously the stockpile of things like ventilators and masks and PPE, $16 billion for our strategic reserve, including money that the president can use for the Defense Production Act. When it comes to the workers and their families and the economic crisis, we put money into expanded unemployment insurance, expanding from 26 weeks to 39 weeks, and adding an additional $600 a week for unemployment insurance. We also did direct cash payments of $1,200 for people making $75,000 or less, with a scale going down if you make between $75,000 and $100,000 a year. It's my understanding that those checks, if you've got direct deposit and you're filing with the IRS electronically, you'll be getting 60 million Americans will be getting their direct deposit of those funds the week of April 13th. There will then be 5 million checks, paper checks, issued a week thereafter, with the lowest adjusted gross income folks receiving their checks first. In addition to that, we've got a new program, $350 billion program being run through the Small Business Administration, Paycheck Protection Program, which is designed to help those businesses, small businesses of 500 and below, to basically bridge between now and when the worst of this pandemic is over. That 8-week period, to the extent that borrowers, that businesses use the funds for payroll and overhead, and they do it in that period of time that is prescribed by the SBA and by the lenders that the SBA is working with, those loans will become grants, fully refunded, and there will be no income tax due in 2021 either for those businesses. So the idea here is to keep people on the payroll, to try to provide a bridge, and to try to link as often as we can the benefits to helping keeping our workforce employed, so that they can continue to receive health benefits and retirement benefits whenever possible, and all the rest of that. So I think the bill should have gone further in some ways. I think it has certain oversight and accountability measures. I wish that it had more, but it does restrict things like excessive executive compensation or stock buybacks, which I think is really important. But we're already talking about phase 4. We're already talking about what we're going to do in the 4th phase. Phase 3 really was about recovery and relief. Phase 4, I hope, is about stimulus and growth and getting the economy back up and running again. So with that, I'd like to turn it over to Dr. Steinberg, who has an introductory statement, and then we'll get right to your questions. Dr. Steinberg.
Thank you, Mike. So I just want to say I'm appearing on this town hall on behalf of myself. I'm not purporting to represent any of the institutions I work for. I do have a lot of different organizations that I work for. So this is just whatever you hear is coming from me as an individual. And I'd like to really thank Mike for everything he does. Such an engaged legislator. I wish they could all be like that. And I appreciate your having me on to share my knowledge and experience with our constituents and other viewers.
Thank you.
I also want to disclose that I'm not an infectious disease specialist. I'm not an intensivist. I'm not a pulmonologist. You know, I'm basically a nursing home and hospice doctor. And that's what I do on a day-to-day basis. I make some house calls. I'm certainly an expert in geriatrics and in end-of-life care. But really my claim to fame before this pandemic started was mostly that I take my dogs with me to see patients every day. Fortunately, that has sadly come to an end for the foreseeable future. I mean, but if you hear them barking, you'll know. And I just want to say, you know, this is a marathon, not a sprint. I keep hearing that terminology. And, you know, Mike and I were talking, we were both runners, and we're talking about half marathons and so on. And right now, I feel like we're barely at the starting gate, really, of this thing. I mean, it's just starting to get rolling here, and some people may already feel somewhat exhausted, and we're barely at the starting gate. I just want to encourage everybody during this difficult time and the much more difficult time that lies ahead to ask for help if we need it and offer help if we have the capacity to do that. We need to be kind to one another. We're going to get through this, but it's going to take a long time, and there are going to be a lot of losses and tears. So I don't want to be overly optimistic and paint an unrealistic picture. We're going to really have the opportunity to see what we're made of and how we deal with the crisis. We'll get to know our families better, certainly, if we're in close quarters with them. And I like to say, I'm a big proponent of advanced care planning, and this is the perfect time to do advanced care planning. And this is for anybody over 18, and maybe we'll talk in a little bit more detail about that later. But this is a perfect time when there's a deadly, very contagious bug out there. Sorry, it's a virus. I shouldn't use that term. This is the perfect time to talk about what kinds of things you would or wouldn't want with your loved ones, whether they're healthy or not so healthy. And I think that's about all I have to say for now, and let's get right to the questions.
Well, thank you, Dr. Steinberg. I'm very grateful for your being with us, and I thought it was great to have somebody with your background and perspective join us. You know, I think it's so critically important. We've said this on our prior town halls. I know that the American people are strong and resilient. I know the people of North County, San Diego, and South Orange County are kind and generous. Now is the time to show exactly those traits and those qualities as we never have before. And I know we're going to do that. I'd like to get right to the questions because we've got a bunch of them. And I'll start with one for Dr. Steinberg. Guillermo in Solana Beach asks, how long can COVID-19 stay suspended in the air after someone sneezes or coughs? And how long can COVID-19 live on different materials, i.e., cardboard, plastic, metal, and saran wrap?
Okay, thanks for the question, Guillermo. So basically, when somebody coughs or sneezes, or if they're in a medical setting where they're getting nebulized treatments or something like that, it's thought that the virus particles can stay suspended for up to 3 hours. On cardboard or paper, they think it can stay infectious for up to 24 hours. And as to metal, if you're lucky enough to have a bunch of copper laying around, it can only live for about 4 hours on copper. But for stainless steel and probably most other metals, it can survive for as long as 2 to 3 days, and the same for plastic. So it's super important to clean surfaces if there's any possibility of contacting the virus in that way. And I would just also say, if you walk in a room where somebody has been in there and has coughed or sneezed, it's not super probable that you're going to breathe it in and get it, but it's within the realm of possibility.
So, Dr. Steinberg, you know, we've been asked this before, and I think it would be helpful just to, again, reiterate kind of what the best practices are if you're getting packages and deliveries and things like that, as so many of our viewers and listeners are. Kind of what would you recommend as best practices?
Well, I'd say if you don't have to open it right away, let it sit for a couple of days. That's simple. Wipe it down with some disinfectant. You could also consider using gloves, and then, but you know, ultimately, whatever it is that's in there, you know, you're going to pull it out. How many days ago did somebody touch it? You don't really know. So I think there's a certain degree of common sense. But if you touch it, and then you go wash your hands, or you do this, then you should probably be okay. Just common sense.
Thank you for that. Natalie in Carlsbad asks, is surf and water access allowed or not? Part of staying healthy is exercising, so how are those in small apartments who can't run be able to exercise if all parks and open areas are closed? Also, dogs need exercise too. Where can we throw a ball? There's conflicting messaging and enforcement. Seems I've punished myself by following the law. Well, you raised some excellent questions there, Natalie. I think the critical thing is that you've got rules coming from each city about what they do and do not permit, and those rules are changing very rapidly. I would encourage you to go to the respective websites. You live in Carlsbad, so Carlsbad actually has a terrific website and a COVID-19 resource page where they've got all of their different rules posted. And I was just on a call earlier this morning with the mayor of Carlsbad, Matt Hall, and they're taking a very cautious approach to all this, very similar to what they're doing in a lot of other places where beaches are restricted and public areas are restricted. I would say, the stay-at-home orders, whether they be from California or they be from the city of Carlsbad or throughout our district, certainly don't preclude you from going outside to, take a walk or to walk your dog or things like that, if you're mindful of the social distancing guidelines. I think that's really the key. That being said, obviously, you don't want to be outside all the time. It's still critically important, if you can, to stay at home. Dr. Steinberg, anything to add about the going to the beach?
No, I would just say we're very grateful for the people that are, in fact, staying at home. I think it's all about flattening the curve here. We're going to get hit hard in the next several weeks. They're thinking this will probably peak in the county here around the end of this month. And whatever you can do to delay the spread of the virus by adhering to those orders is just so much appreciated, especially by those of us who work in healthcare. And maybe I can just say, God bless the people that are on the front lines, including the people working in nursing homes, hospitals, emergency rooms, ICUs.
I certainly echo those comments, Dr. Steinberg. They're absolutely our heroes, everybody who is working on the front lines of the pandemic, whether they be our medical professionals or, for that matter, the people that are stocking the grocery shelves and driving the delivery trucks and dropping our mail off. I mean, everybody that's out there doing their jobs are really our heroes during this time.
First responders, do not forget.
Oh, absolutely. Our first responders, no question about it. Ed in Dana Point asks, when you feel the virus coming on, what should you do for home care? Why go to the hospital and lay with other sick folks? Would it not be better to stay home and do what? Are gloves a better protection than a mask when out and about? Dr. Steinberg, I'll let you handle this one.
Okay, yeah, thanks, Ed. Absolutely, stay the hell out of the hospital if you possibly can. They're just not good places to be in general, and particularly during this sort of time. If you've got a mild case of the coronavirus or any other self-limited illness, you should definitely do self-care at home. I would temper that with the knowledge that the symptoms can come on severely and rapidly in people, and if you start getting significantly short of breath or having other sort of unmanageable symptoms, don't hesitate to get seen at a hospital. You can contact your doctor's office to get guidance. I mean, if you're not literally gasping for breath, and I would really encourage you to do that. As far as the masks, there's conflicting data out there. Historically, we've always said, masks are really for the sick people, and also for people who are directly contacting them. There's some data that wearing a mask or universal masking can be helpful. To me, one of the best things about a mask, if it's used properly, is it keeps you from touching your face, okay? So that's something to consider. If you're going out and about and you're wearing a mask, it's certainly something to consider if you've got a mask. My friend Yana, her mom in Florida, just sent me these homemade masks, and I think they're worth using. They're not going to keep the virus from going through it necessarily, but they are going to. They'll remind whoever wears them not to touch their face. As far as gloves, I don't think gloves really add anything beyond good hand hygiene. But again, it can be a reminder. And if you're touching something that you think may have had contact, then you take the gloves off and wash your hands. Is that better than just washing your hands? I don't know, but it certainly doesn't do you any harm to use those types of equipment.
Thank you for that, Dr. Steinberg. George in Cardiff asks, is the virus negatively affecting the readiness of our Marine Corps? That is a great question. And what I can tell you is that we've got some amazing leaders locally. General Osterman General Conley, I'm in touch with all the time, and they're actually doing a lot like this. They're doing virtual town halls and so forth at Pendleton and throughout the San Diego community, and I think they are absolutely ready and prepared as they always are, but they're also being very mindful of the impact on the base and on day-to-day life. They're doing social distancing just like any of our other cities. They've set up a temporary triage facility there on base for people who are showing symptoms or they believe might be COVID positive. They have what they call health protection condition Charlie, and again, they're just doing an amazing job. They're absolutely our heroes. My hat's off to them. And I also know that the Marine Corps Recruitment Depot in downtown San Diego, as of an article that I just read earlier today from KPBS, they're still moving forward with making Marines there, but they're doing it in a very mindful way with regard to social distancing protocols, and they're testing everybody all the time, making sure that everybody is okay. So I think our Marines, our sailors, are the best of the best, and I'm grateful to them for their service. And obviously, my heart goes out to all those that were on the Theodore Roosevelt as well. I know 3,000 are getting off that ship right now, and others will remain for the essential functions of the ship. But obviously, we're tracking all that very, very closely. Dr. Steinberg asks, Janice in Oceanside asks, for Dr. Steinberg, I take hydroxychloroquine for my lupus and was told by a Kaiser pharmacy worker that Kaiser is keeping hydroxychloroquine for those critically ill with COVID-19. They couldn't say they were out and couldn't get any more. This medication has been an integral part of my being able to live a healthy, active lifestyle since 1988. Does this mean I won't be able to get my medicine until I end up in a hospital critically ill in a lupus flare? Great question, Janice.
Yeah, Janice, I'm sorry you're looking at that situation. That's unfortunate. What I'd say about that is a couple of things. I mean, first of all, I'd probably give your rheumatologist a call if you haven't already done that. Hydroxychloroquine or Plaquenil is not particularly expensive. So far, I haven't heard of any real price gouging, and it may be available in some other local pharmacies. So I think it's worth maybe doing a little research to see if you can get a supply that way. And short of that, I know there's a lot in the pipeline that's expected to be delivered in the not too distant future, but certainly it would be best not to run out at all. There are, of course, many other medications that can be used, but it seems like you've been on something for 30 years. It's doing the job. If it's not broke, let's not fix it. On the other hand, there's fairly good evidence that this medication can help critically ill people with this COVID-19. So certainly it's reasonable to want to make it available to them. Anyway, I hope that answered the question.
Thank you for that, Dr. Steinberg. Harold in La Costa asks, is Congress going to allow the Treasury Department to distribute the loan money in this bill without disclosure to the Inspector General in Congress? No, we won't. Is it my understanding that Trump said that he would not abide by this requirement in the relief package? Well, what happened was we passed the bill on Friday in the morning by voice vote when we had a quorum present. And then Friday afternoon was the signing ceremony where the president did insinuate that he may not follow the letter and the spirit of congressional oversight. It wouldn't be the first time that the president didn't want to follow the letter and the spirit of congressional oversight. But make no mistake, we're going to use all of our oversight authority as we have under the Constitution to ensure that this money is distributed fairly and equitably and transparently. The other thing I'll mention to you is that the oversight will continue where there's already a bipartisan call for a national 9/11 style commission to investigate, kind of what happened during January, during February, during March with regard to the early stages of the coronavirus crisis. And, we'll be, I'm sure, learning more about that commission But in the near term, of course, the primary objective is to reduce the number of cases and the number of deaths as much as we possibly can. That's our primary focus. Teresa asked a question for Dr. Steinberg. How do you quarantine a family member who's been told they've possibly been exposed recently to the virus at a doctor office, etc.? Do they stay in the same house or apartment? What if you can't afford to go somewhere to stay away from said family member? How do you protect your family if a family member has to still go to work and be out there working with the general public? Should I go back to my home healthcare duties with my current client if I don't have PPE?
Wow. Okay, those are some exceptionally difficult questions, and I wish there was a simple answer to those. I think everybody's specific situation is a little bit different. I would say, and the answer to the question really depends on those circumstances, on what kind of resources you have, and how risk averse you are. In general, people are not going to have the ability to live in different places. So generally family members are going to have to work things out. So you can do social distancing within your household and do all of those other ordinary things that you would do. You stay at least 6 feet apart, clean the surfaces on a frequent basis, do frequent hand washing, don't touch your face, and the risk of transmission is going to be low. As far as going back to a home health job where there's direct contact with a client without PPE, probably not advisable at this point. I think it'd be worth checking with both your doctor and the client's doctor if possible. How badly does the person need the help? Is there somebody else that can give it? There's a whole bunch of factors that go into that. And I think before too long, we're going to have people who've had the illness, whether it was severe or not, and they were going to be immune or no longer shedding virus, and then that will make it a lot less of an issue to answer questions like that. If you've had it, then there's no reason you shouldn't go out and be able to take care of somebody.
Thank you, Dr. Steinberg. Jay in Del Mar asks, given the importance of maintaining jobs following the impact of COVID-19, can you please provide an estimated time frame as to when the Small Business Administration loans will be made available to companies within the district? Our application was submitted. Our application was submitted almost 2 weeks ago, but it is unclear if the loan will take another 2 weeks or another 2 months, which is making planning very challenging. Well, I would be remiss if I didn't mention that our office stands by as a resource for any constituent or any small business or any business that wants help with their SBA loan process or application. It's a very, very simple application for the new Paycheck Protection Program. And based on your question, sounds like it's probably one of the $10,000 emergency disaster loans. I would recommend you contact our office. You can go to mikelevin.house.gov, go to our the bottom of the page and see the links to our district offices, and just give us a call or call our DC office as well. With regard to the Paycheck Protection Program, that's the $350 billion loan program that I mentioned before, which will provide up to $10 million to a business 500 or under. And it's designed to be fully forgivable if, in fact, it's used for payroll and overhead and within a prescribed time period. What we have been told is that the lenders will begin receiving the applications, and it's a really simple 2-page application this Friday. So we're talking about this week or maybe at the beginning of next week. But some of our local banks have already been in touch with their small business clientele. And if your local bank does business with SBA, or if you're able to get SBA credit facilities through your local bank, then they're in all likelihood going to be providing the opportunity to get a Paycheck Protection Program loan as well. Let's see here. This is one for both of us, Dr. Steinberg, from David in Oceanside. What date or objective number of cases will be required to give an all clear or indication that we're no longer at risk? How come the Secretary of Health and Human Services didn't do their job and prevent the disease from coming into the country or prevent the spread from state to state? Of course, Secretary Azar is not here to defend himself. I'm sure he would take exception to the last part of the question. But how about for the first part, what date or objective number of cases will be required to give an all clear or indication that we're no longer at risk?
You want me to take that? I mean, there's no set number. Like many other illnesses, I mean, this is brand new, so people are not immune to it now. There's a good chunk of our population that will be exposed to it, that will have it, whether it's mild or severe, and that then will be immune at least to this exact strain, which is SARS-CoV-2 is the virus, and COVID-19 is the name of the illness. So I don't think there's an exact number, but as testing becomes more available, and there'll be antibody testing, which will show that you've had it, then I think as far as an all clear on letting people go out and go about their business, we're definitely months away from that, I'd say. And, you know, as far as people doing their job and letting the virus into this country, I don't believe there'd be any plausible way to have really kept it out. We've got a late start on some of the things, and there will be plenty of time after all is said and done, and I think a commission like what Mike was talking about to investigate what went wrong and what can be done better in the future to prevent something like this happening is a great idea, but right now is probably not the time to be trying to assign blame and so on.
I generally agree with all that. I think, you know, what I've read, and I by no means am I an epidemiologist or, you know, a modeling expert, but reading the University of Washington modeling that Dr. Birx and Dr. Fauci have referred to, Dr. Birx in particular yesterday at the White House briefing, it's clear that, you know, April is going to be very, very difficult for most of the country, including here in California. I think the peak in terms of number of deaths per day is projected to be April 27th. After which things would begin to show improvement, but still would be very, very frankly, difficult for the balance of May. And only until the end of May do you really see the tapering off of the cases and deaths, where we even get to the level that we are at right now today. So think of where we are at right now today. We're looking at, 6 to 8 weeks before we get back to this level. In other words, it's going to get worse, and then it'll peak around the end of April, and then it'll get better throughout May. And then by the end of May, hopefully, we'll have gotten to where it is today. And then on into June, things will hopefully calm down significantly so that, towards the middle of June, life begins to look somewhat like normal again. Of course, we heard from Governor Newsom and Superintendent Tony Thurmond today, very likely that, schools are going to remain closed for the school year, although, each district hasn't issued that specific guidance yet. But certainly it appears that's where things are headed. That's also why when we designed the CARES Act, particularly that small business loan program and the expanded unemployment insurance, we were thinking through April and May as being very, very difficult months, and hopefully things getting much better in June, July, and on into August in the fall. But we can't, one of the other things that I've read is we can't jump back in and stop social distancing and have everything go back to normal too quickly, because if that were to happen, then it would have potentially very, very negative consequences and could lead to a resurgence of cases and of deaths, unnecessarily so. So, let's see. Christine in San Marcos asks, I took a job as a cashier/pharmacy associate for a local pharmacy. We're offering free curbside and mail order delivery services so that people aren't required to walk into the store. However, many people do not utilize these alternatives and choose to shop inside the store. I think many people are using grocery shopping and trips to the pharmacy as an excuse to get around the stay-at-home order. What can we do to better enforce social and physical distancing in grocery stores? How can we limit people from going to the grocery store several times a week just to get out of the house? Well, I'm a broken record, but follow the guidelines and stay at home unless absolutely necessary. And I think what we can do and what we must do is continue to explain the risks. associated with travel, associated with coming in contact with other people. That's what Dr. Steinberg and I are trying to do today. That's why we do so many of these discussions with doctors and public health experts. Just as you can catch the virus from others, you also may be asymptomatic and maybe unwittingly spread the virus to others. And so we have to, I've heard from a number of experts, we have to always act as though the folks around us, when we're out and about, if we're out and about, that they have it. And just the same that we have it ourselves, to try to prevent the spread from ourselves to other people, because 80% of the people with it don't know they have it, from everything that I've heard. Anything to add to that, Dr. Steinberg?
Nope.
So Greg in Carlsbad asks, and this is for you, Dr. Steinberg, I've heard estimates on when a vaccine will be available from 6 to 18 months. At the current infection rate, it will affect half the people in the world by then. Is there a test that can be done to indicate you've already had the disease or no longer contagious? This would be important for people that have very mild cases so that they can go back to their lives.
Right. So on the vaccine front, they're still doing phase 1 trials. I think that they're on basically the third and strongest dose right now. And then, if that seems to be successful, then they'll move on to phase 2 trials and phase 3 trial. I'd say probably early part of next year is what we're looking at for, this to become available to the public. And as to how effective it will be, it's hard to say. But I think we can hope that it'll be an effective vaccine. And as far as, the number of cases, right, we're expecting most of the country to come in contact with and have some level of immunity just through sort of an organic way of picking it up in the community or something. But your question about testing, yes, there's an antibody test. There are kits that are already available for that. I think they're maybe about $60 or $70. They just tell you that you have had contact with the virus. I don't know, exactly where they are with FDA approval and that. But you might check with your doctor to see if you can get one if you think you might be one of those people who already had it. The sooner these types of things are made generally available to the public, I think, the better, because it looks like once you've had it, you're immune, and then you can kind of go about your business and not worry about picking it up from somebody. And unless you're, touching it and then transferring it to somebody else, you wouldn't have to worry about that either. So those tests they're out there, and you might check with your doctor to see if you qualify for one. A lot of doctors aren't seeing a lot of patients in person these days. They're doing a lot of telemedicine and so on. And for now, that's probably a good thing. But they're basically like a finger stick test. You put it on like a pregnancy test, except with a drop of blood. The results are in 5-10 minutes or something.
Thank you for that. Go ahead.
Let me those tests don't tell you if you have an active case or not. They just tell you that you've been exposed to it. So you could still be contagious, especially if you just picked it up. And the only way to tell that is to get a swab and see if you actually have active viral RNA. And
the only thing I would add is I've been in touch with so many of our local companies in North County who are working on not only a vaccine, but therapeutics and diagnostics, and they're doing an incredible job. Obviously, when the magnitude and the scale of this became so apparent, the need for testing became so apparent, they really jumped into action in a very positive way. And we've got other companies that are manufacturing, normally manufacturing a wide variety of medical devices and other types of things, and they're now manufacturing ventilators, and really been incredible to see the type of response that we've had from our local business community here. Dan in Ladera Ranch asks, how can Dems audit the White House? Well, first of all, everybody has oversight responsibility in the Congress. How can Dems audit the White House on the $500 billion stimulus money? Trump has already said he would not abide by the oversight. Also, how come the stimulus does not cover people that make over $100,000 single? That is middle class in your district. Two great questions. The oversight question we've addressed. I'm glad that there are certain things in the bill that limit, executive compensation being out of control for those companies that have gotten some of that money. Just the same, limits on stock buybacks, I think, are really important. And just to explain this, you've got $350 billion in a fund administered by SBA for companies under 500, and then you've got about $500 billion in the bill for larger businesses, and specifically that's where money for things like the airline industry and other companies exist. A lot of that is a lending facility for the Fed to add liquidity for those businesses. But look, I think at the end of the day, your point is extremely well taken about the $100,000 limit. And again, I certainly wouldn't have advocated for that. I think a direct cash payment with a higher income limit would have been more prudent. In our district, $86,000 is the median income. And our average cost of a home is $720,000. So what I have advocated for in the past and will continue to advocate for as part of phase 4, are for policies that will help middle-class families, as you, Dan, define them, middle-class families in our district that might make more than $75,000 to $100,000 a year. And one of those policies specifically is the full deductibility of state and local taxes. We passed in the House last year in December a repeal of the state and local tax deduction cap of $10,000. That cap was put into place as part of the 2017 tax bill. And I thought it was very unfair and punitive. And we passed that in the House, and we're going to fight hard in the phase 4 stimulus to see what we can do, because ultimately that is money that will go directly back to people right now, will go right back into the economy. And it will, in my mind, correct a major inequity of the 2017 tax bill, which at the end of the day was a huge hit to many of the working families of the 49th district. As I've said many times, in our district, we've got well over 40% of our taxpayers that take the SALT deduction. On average, they take about $24,900 when they deduct using the SALT deduction, so capping it at $10,000 was a huge hit. I'd also like to see in the phase 4 stimulus, far greater aid to states and local governments. $150 billion was better than some of the folks on the other side wanted, but we know it isn't nearly enough. And in California, we're going to get $15.3 billion of the $150 billion. We've already spent that money. Governor Newsom has already spent that money. We've already, unfortunately, had to tap into our rainy day fund of $21 billion as well. So your points are well taken, Dan. There's a lot more that we're going to do on phase 4, and I appreciate your questions very much. Dr. Steinberg, Nadine asks, I saw that the COVID case count for San Diego since March 7th is 519. I'd imagine it's probably gone up since then. Does that reported number take recoveries into account? Or maybe the better question is, have there been any recoveries yet? I noticed other counties in Northern California are reporting recoveries, which is why I ask.
Yeah, that's a great question, because probably the best statistic is active cases, right? Yeah, I think we've got over 800 cases in the county now, 15 deaths. And an interesting statistic is out of the decades of life, the largest number is people in their 30s that have been positive. But yes, there's been quite a number of recovered cases already. It's just not everybody gets tested at the end of the course of their illness, so it's a little bit hard to put those numbers together. But there's a decent number of recovered cases, and I think if you look on the county website, you can probably figure that out from active cases, total cases, deaths. The only other thing there is besides that is recovered cases.
Another one for you, Dr. Steinberg, from Mindy. Considering how many people have mild to no symptoms and will never be tested, why are we hearing about numbers every day? Isn't it true that we'll never know how many people will get this virus? People with mild symptoms are at grocery stores. They're not sick enough to stay home or get tested. So how are people really protected buying food, especially as stores are too impacted to deliver?
Yeah, well, I mean, as far as going into stores, yes, of course, you're putting yourself at some risk by doing that, and you know, all you can do is take ordinary precautions. If you absolutely have to go to the store, you got to go to the store. I know there are a lot of, you know, young people who have volunteered to go out and do shopping for people, and particularly people who are at high risk. That might be something to consider. As far as knowing what the actual numbers are, that's something that the epidemiologists will have to work out down the line. But you're absolutely right. There's a lot of people in the county, or, you know, all over the country and all over the world that will never know whether they had it or not. And, you know, very sad if you've been watching what's been going on in Italy. You know, they've got nursing homes where they've had dozens of deaths, and, you know, the people just suddenly get this severe respiratory illness and they die. You know, the hospitals weren't able to take them, and those don't even get counted in case numbers, even though it's highly probable that they were among those, and they don't get counted as deaths or cases. Certainly third world countries that don't have any real access to testing, you know, so it's not perfect. I think in our country we'll have some pretty good ideas about the numbers, but it'll take a while. And because there's such a wide array of symptoms, you know, from zero symptoms to death, it makes it really hard to know what's going on real time. So thanks that's a great question.
Thank you for that. Dr. Hinchberger asks, for your upcoming town hall, or he says, for your upcoming town hall, please discuss the plans and considerations for the homeless population here in Oceanside, California. Well, what I'll do is broaden it just a bit and talk about you know, what's happening with planning for the homeless population generally, because it's on everyone's mind. And I think that the state is doing a lot. You know, obviously there's a huge amount that we're doing at the federal level as well, and on the city levels. The state is making $150 million available to local governments, and, you know, that will be reimbursed by FEMA, at least in part. A lot of localities are setting up hotels or other, you know, I know in downtown San Diego, they're setting up the convention center. They're now housing 1,500 people at the convention center. They're looking at Golden Hall as well. And then in Orange County, they're doing similar things with hotels and with other sites. I know they're also setting up separate facilities or using hotels in separate ways for those who are symptomatic or they believe do have COVID-19. And, you know, I think we're going to see, hopefully, a containment of too bad of an outbreak among the homeless population. I think that these measures will help a lot. And the stimulus included $4 billion specifically to help the homeless populations throughout the country. But we have to do a lot more on housing. You know, I applaud the efforts of those cities and of Governor Newsom to curtail any increases in rent. I advocated, and we successfully got in the CARES Act, a moratorium on foreclosures during this for the federally backed Fannie, Freddie, FHA, or VA home loans. I know a number of the other lenders, big commercial lenders, have done just the same. But make no mistake, we've got to do everything we can to keep people sheltered. You know, if we're asking people to remain sheltered in place, we better have shelter for them. So your question is very well taken. Dr. Steinberg, Rhoda asks, is it okay to touch my face, i.e. to scratch an itch, if I don't touch my eyes, ears, or nose? And I think we were saying this before, Doctor, talking about it makes you more likely to want to scratch your face.
Yeah, it sure does. I want to scratch mine right now. And yeah, you know, it's funny. I would say, first of all, if you are at home and nobody's going out and you're not touching anything, you know, there's basically no risk of exposure, then you can scratch your face all you want. In general, it's good to keep your hands away from your face. You know, if you come from way outside and come and scratch a little itch up here, you know, you're still in that neighborhood, this neighborhood between here and here. So, it's common sense. If you have been around anybody or anything or touched anything that might even remotely have the virus on it that can be around for 3 days, you probably shouldn't be touching your face anywhere, but it'd be better to touch it up here than to, pick your nose or put your hand in your mouth or something like that.
Well, I have a 7-year-old and a 6-year-old, and that was my directive. Do not pick your nose. Of course, that would be my directive anyway, but with a 7 and a 6-year-old, sometimes it's hard.
Yeah, good luck with that.
Exactly. Samantha in El Cajon asks, is there a way for San Diego County residents to report non-essential businesses for staying open despite the order for them to close? For example, there are several barbershops and a tattoo shop still open for business and nobody has done anything to make them close. Is there a way residents can call to report them? I would recommend you call your city and you try to get in touch with your local police, and you can at least tell them. Every city is doing something different with regard to this. Orange County set up an 800 number. If you go to their COVID resource page on Orange County website, and I would imagine there are similar resources in San Diego County, though I haven't seen them, where, if you see a restaurant that, is still seating people and treating things as normal, or a non-essential business that is treating things as normal, you ought to call local law enforcement, let local law enforcement know about that. Dr. Steinberg, Carrie in Carlsbad asks, will having the pneumonia vaccine help a person infected with COVID-19 to avoid pneumonia?
Good question. So COVID itself can cause a pneumonia, a very significant pneumonia, and or respiratory distress syndrome with a lot of secretions and requiring very high pressures to keep the lungs open. So that's kind of a pneumonia in and of itself. The pneumonia vaccine, which would be like Pneumovax or Prevnar, that is pretty effective against one particular strain of pneumonia, which is strep pneumo or strep pneumoniae, pneumococcus. So you can get COVID and have a bacterial pneumonia on top of it. So it would certainly help prevent getting a pneumococcal pneumonia on top of the COVID respiratory infection or pneumonia. But it wouldn't necessarily help in general. It's not going to help prevent this virus. It would just prevent you getting the pneumococcal pneumonia on top of it.
Thank you for that. Next question. Sharon in San Clemente asks, why is there no effort at the federal level to coordinate resources and facts? Wow. Well, I'm trying my best. I think it's easy to get overwhelmed with all the information that's out there, all the resources that are out there. I have tried to make everything as easy as possible for the people that I represent in South Orange County and in North County, San Diego. If you go to our website, mikelevin.house.gov, we've got an entire page of resources on COVID-19. I also highly recommend visiting the 2 counties have websites. San Diego County at sandiego.gov, Orange County has some great resources as well. If you just Google County of Orange, County of San Diego, you're going to see those links. I know we're trying our best here at the local level in our counties to get the information that's relevant and timely to our communities. But you're right, there isn't always a consistent federal message. I am glad that at last night's or yesterday afternoon's press avail, that the president was on the same page with Dr. Fauci, taking the warnings from him and others at face value. This is something that, I'm deeply concerned anytime that that's not the case, because we can't have incorrect information out there. We can't deny the seriousness of this. Not one more time, not one more day. And you have my commitment that we won't do that here. Dr. Steinberg, Terry asks, what evidence exists that someone gets immunity after getting COVID-19 When will testing be fast and abundant, as this will help get back to the workforce?
Yeah, again, the evidence we have right now suggests that if you've had the illness, even a mild case, that you will have immunity to it. That's not 100% for sure, but I think that's what most experts agree on. And again, the testing should be available. I mean, it's already available. Antibody testing or immunoglobulin testing is available, but it's I don't think it's mainstream yet. But it's available here in San Diego County, and I think your doctor could probably find some and obtain some. I don't know what insurance coverage would be, but it's not something. It's not like one of these $3,000 tests, and maybe it's like 60, 70 bucks or something.
Carolyn and Vista asks, would you please tell us how many COVID-19 cases are in each area you represent? Well, we did that at the top. Both San Diego and Orange counties, they published this data. But again, as of before we just got onto this live feed, 849 cases in San Diego County, 15 deaths, 606 cases in Orange County, 10 deaths. And then if you go on those websites, you can see it broken down by, in San Diego County by zip code. In Orange County, you have it broken down by city. And I was struck, there isn't any part of my district where it hasn't hit. Every zip code, every city, there are cases. You look at just the numbers, raw numbers, and it might be 2 or 3 per 10,000 population. So you figure a city of 20 or 30,000, you're gonna see cases across the board. And that's how it is. And I noticed, Carlsbad, Encinitas, Oceanside, no one is immune from this, unless they got the virus, and then I guess they're immune. But in terms of where you live, everybody in our district, that's why you need to stay at home. That's why you need to follow the orders of the medical professionals.
Yeah, I would also comment that, as of now, our hospitals are not full. They're not, the ICUs are not full yet. That's anticipated to come along in the next couple of weeks. But it probably will exceed the capacity of our intensive care units. And then, people will be left with these very difficult decisions, which hopefully we'll have some guidance from the county, and it's not going to be a bedside decision where a doctor is placed in the position of saying, who gets the ventilator here. But it's going to be exceptionally difficult, I think. But for now, just keep doing what you're doing. Stay at home, and that'll tax the hospital system less. The slower that curve rises, the better for everybody.
The modeling from the University of Washington suggests that California will be right at capacity of its ICU beds towards the end of April. Basically all the ICU beds in the state will be taken up by COVID-19 cases. We know that California Department of Public Health has its own modeling as well, and that the governor, along with our local and county representatives, are doing everything that they can to try to be as creative as possible with regard to local and regional hospital capacity, as well as the need for ventilators and PPE and all the rest. And what we've tried to do at the federal level, and it's extremely frustrating to see, when things don't go as we hope they do. But we've tried to provide the money, and we've tried to provide guidance to the appropriate agencies to do whatever you need to do to get those essential resources out where they're needed. And the fact that it took as long as it did for the president to invoke the Defense Production Act, and that he still hasn't invoked it to its full extent, I simply find that beyond my comprehension, and he needed to do it a month ago. But again, hopefully we'll move forward in a positive way. George asks, why isn't the public informed with more details on how new confirmed cases are connected with the previous confirmed cases? It seems the U.S. is behind on informing the public on how the confirmed cases are connected. Interesting question, George. Dr. Steinberg, you want to tackle that?
Yeah, it is a very compelling question. I don't think we can really answer it. It's not like some illnesses where you can really do contact tracing, and go back to sort of patient zero and that sort of thing, because it's such a, tricky virus, right? And in a lot of cases, you won't know where you actually contracted it. So you could have gotten it off the surface. You could have gotten it from being in close proximity to somebody. And when you have a small number of cases, it's much easier to do that. If everybody ate at this particular taco place and got sick, then it's easy to put together that, okay, it was something in the tacos. But this is a lot different from that. It's so much bigger, and I don't know how fruitful that's going to be at this point. I think probably our resources are better spent trying to address the actual illness itself.
Another one for you, Dr. Steinberg. This is from an anonymous constituent. My wife is a health professional in the 49th district. Up until just a few days ago, their PPE consisted just of scrubs, and they were not allowed to wear masks. They were not given justification as to why they were not allowed to wear masks, but it is my wife's opinion that they're rationing due to low initial supply. Just 3 days ago, they were given surgical masks to wear, which are not as effective as N95 masks. This is unacceptable for health workers who are on the front lines of this fight. So my question is, what are you doing? Actually, this one's for me, not for you, doctor. What are you doing to ensure that all of the health professionals in your district get an adequate amount of personal protective equipment that they need to not put themselves at greater risk? Well, first of all, let me just express my gratitude to your wife for the work that she's doing on the front lines of this crisis. And as we said before, to all those frontline medical professionals for their extraordinary work during this time, putting the health and safety of others over their own, in many cases, health and safety. What I can tell you is that the new CARES Act, the coronavirus relief bill, provides $100 billion for hospitals, specifically to go to PPE and really whatever those hospitals need. And there's another $16 billion to replenish the strategic national stockpile for things like PPE and ventilators and masks. And we were told weeks ago that 3M was going to manufacture 500 million new masks. And so every time we get an opportunity, we ask the administration, where are the 500 million masks? They need to get out to the field as quickly as humanly possible. Many of our hospitals and many of our governors, including Governor Newsom, they're doing everything they can to find their own sources, whether they be international or domestic sources of PPE, of masks, of ventilators, even having ventilators reconditioned. We were sent 170 ventilators in California from the strategic national stockpile that were defective. So we had a company that doesn't even manufacture ventilators, but filled with very smart people that said, we can fix those. So that's what happened. I know for a fact that many of our local companies that normally don't make ventilators, they're getting in that business, normally don't make masks, are getting in that business, not to make a huge amount of money, but because it's the right thing to do during a crisis. All hands on deck, and that's why we need the Defense Production Act used to its fullest without delay. Joseph and Encinitas asks, and I think this one is for you, Dr. Steinberg. Every other year, we hear the statistics of seasonal flu. This year, none. Please compare the number of cases of seasonal flu along with the number of cases of COVID-19. It seems to me that there are more cases, death and in total, of seasonal flu than there are COVID-19, even in those that have received the flu shot. And it's been that way for years. I don't expect that you will field my question because there seems to be a concerted effort to only report COVID. Well, Joseph, there you have it. We just, got your question out there, and I will turn it over to Dr. Steinberg.
Yeah, thank you for that question, because I think, for people who are on social media or may hear sort of another side of things, it's like, oh, this is, the flu is so much worse than COVID, so many more people die of it. And I'm not suggesting that that's the way you were asking it, but maybe it is. And I don't hear too many people saying that lately. But in answer to your question, San Diego County has had 20,000 cases of flu this year, 100 deaths, a little bit over 100. So as of today, there's more flu deaths than COVID. To compare influenza A with this SARS-CoV-2, it's really apples and oranges. I mean, flu is an illness that we know very well. We create vaccines. They're always trying to estimate in advance a vaccine that's going to be effective because the virus mutates a little bit year to year. So some years it gives more, it confers more immunity than other years, but it always confers a decent amount of immunity. And I hope everybody gets flu shots. There are people who don't believe in it or whatever, or they got sick one year. I hate to just say that's stupid, so I won't say it. Or, I said it. Oops.
You can say it, doctor. It's okay. Right. You can say it. You can say it.
I mean, there's evidence, there's science, right? But anyway, so you compare, and we've got treatments for flu, right? There's a pill that you take, one pill that's the most effective thing. Xfluza, I think it's called, Zofluza, I can't remember the name of it. And then, of course, there's Tamiflu. So we've got treatments for it. So only a rare, it's like way less than 1% of people who get influenza A die. Also, most people who get it do get sick, and you get pretty sick, right? And you're sick, maybe you're off work for a week. It sucks, right? It's not a fun thing. But this virus is totally different. It's got, very mild cases, asymptomatic cases where you don't even know you have it, all the way to, adult respiratory distress syndrome, respiratory failure, and death. So, they're just very different. Plus, we have no treatment for it and no vaccine. I'm confident, sadly, that the numbers of deaths this year for COVID-19 are going to be substantially higher than flu deaths. The other thing that they kind of have in common is that the severe cases you see them in the older and more medically frail population, both illnesses. But unlike flu, COVID-19 does not seem to affect the other side of the spectrum, right? You don't usually see it in infants and children. We just had our first death in a child less than 1 year old, I think, within the last week. I mean, that's one out of many thousands of cases, tens of thousands of cases, hundreds of thousands of cases. So,
thank you, Dr. Steinberg, for that. Kerry in San Diego asks, will California follow suit with the other states that have issued an executive order for temporary relief from appearing in person before a notary public? Interesting. Some states have already put an executive order in place to help with this. Kerry, that is a great question. I don't know the answer to that, but I will bring it up with our friends in the governor's office because it will ultimately be up to them. What I would suggest you also do is probably contact San Diego County, depending on what document it is that needs to be notarized, and ask them as well. But that is a really good question. Well, with that, I think we're just about out of time. We're a little over. We were supposed to go an hour. We went a little bit over an hour, but I'm very, very grateful for everybody asking these excellent questions. We got a bunch of questions during the town hall. We're going to inventory them, and we're going to do it all over again next week. If you're up for it, Doctor, I'm up for it.
Okay, yeah, I'd love to do that. And, in the meantime, maybe I just like to say, I'm very grateful to be asked to be part of this. And I'm just going to ask everybody to, again, be nice to each other. This is, I'd say, try to not spend too much time watching the news, listen to some music, catch up on some pleasure reading, or, binge watch some TV shows, play some board games. If you play an instrument, maybe now's a good time to pick it up, walk, run, do yoga, little spring cleaning maybe, go through your old pictures and videos and just be kind to one another. And again, I didn't have time to talk about it. Maybe we can spend a little more time next week, but you can download an advanced healthcare directive online and designate a person to make decisions on your behalf if you become incapacitated. And this is a great time to do it. I mean, we could all go out and get hit by a truck. Well, not today since we're sheltering in place, but in general, some awful thing could befall you. And then, if your family doesn't know what your wishes are, some people want to be kept alive till the last possible instant that the medical technology allows. Other people say, if there's no chance of me recovering or making a meaningful recovery, then I would much rather concentrate on comfort and dignity and not be put through all those medical interventions like ventilators and so on. And that becomes especially true when you get older and when you develop multiple medical conditions. There's a little something called a POST form for people who are seriously ill that, you know, can have like a DNR order. So if the paramedics come, they don't do chest compressions and so on. And maybe we can talk about that a little bit more next week. But in the meantime, I would recommend, since you're sitting around the house, go to theconversationproject.org, I want to say. I should have checked this out beforehand. Just Google The Conversation Project. It's got some great tips about how to have these conversations with your loved ones. And this is a great time to do it. So thanks for letting me get that message out.
Carl, if they want to follow you on Twitter, how do they do that?
Oh, I'm at Carl Steinberg, and it's KarlSteinberg.
Excellent. Well, listen, I just want to thank Carl again. I want to thank my whole team who are working so incredibly hard. I can tell you, both in our district offices in Oceanside and Dana Point, as well as our folks in Washington, D.C., they're doing some of the most important work that they'll ever do in their careers right now, helping our constituents, helping our great communities in the 49th District. I want to thank our videography team for putting this together successfully again. I want to thank everyone for tuning in, whether it was on Facebook or on YouTube or on Twitter. And I encourage you all, again, to go to our website at mikelevin.house.gov. We've got all sorts of resources, federal, state, and county and local resources. Please, please, please follow the guidelines of the CDC, of our state of California, of our counties, and of our cities. Please follow those guidelines. It's the absolutely most important thing we can do. We cannot say it enough to try to flatten the curve, to try to minimize the worst of this virus. We'll get through this together, just as we get through everything as Americans together. We're going to be strong and resilient and kind and generous. And until next time, thanks for watching.